Morning, everyone. Thanks so much for joining today. My name is Mark Fetterhoff. I'm the program manager for AARP ElderWatch in Colorado, and today we're going to be talking about Medicare Open Enrollment. As many of you know, Medicare Open Enrollment started last week, so this is very topical. And again, as I said before, for those who just logged in, we will be recording today's presentation and sharing it widely because I know there's lots of older adults out there in Colorado who are looking for this type of information as they're being inundated with the different types of marketing tools and potential scammers who are taking advantage of this open enrollment period. Today we're joined by two experts from the Colorado Division of Insurance, and I'm thrilled to have them here as part of today's webinar. And Kathy Madden is going to start out, and she has been with the Division of Insurance managing the SHIP and SMP partner services and training manager for the past 12 years. So she has a wide variety of knowledge in Medicare, Medigap, Medicare Advantage, and Medicare-related topics. So I'm thrilled to have Kathy with us, and also Rashana Bateria. Sorry if I again pronounced her name wrong, Rashana. She is the complex interaction specialist, also with the Division of Insurance. She works very much on working. She's a staff lead with the Division of Insurance on all things involving suspected Medicare fraud, errors, and abuse for the Senior Medicare Patrol. And so these are, again, two great resources that we have with regards to Medicare Open Enrollment, but also just year-round with regards to Medicare. So I'm going to go ahead and start off. I think Kathy's going to start off, and we'll get going. Go ahead, Kathy.
Thank you, Mark. Thank you so much for joining us this morning. We appreciate you being here to learn more about SHIP and the upcoming Medicare Open Enrollment period. So let's get started. So as we know, Medicare Open Enrollment, or you'll see it referred to as OEP a lot of times, is upon us. Like Mark said, it started last week, and it goes through December 7th. It's the perfect time to join, switch, or drop a Medicare Advantage plan. You can drop or switch a Part D prescription drug plan, and you'll hear those referred to as PDPs. You can switch from original Medicare to a Medicare Advantage plan or vice versa, or you can choose to keep your current coverage. But I would only suggest doing that after you've done some comparisons to make sure you can't find a better plan or a less expensive plan. So Medicare enrollment runs every year from October 15th to December 7th, no matter when those dates fall. And this year it falls on a Saturday, so Medicare will take calls until midnight on Saturday, 12/7. Go ahead, Mark. So Medicare plans can change every year, including the costs, the coverage, and the providers. And they usually do. So I really like to counsel beneficiaries too that it's important to look at that every year. If you want to stay with your doctor, you should probably make sure your doctor is going to take your plan for the upcoming year, because that's very important to people. You want to compare during OEP, you can help people find better coverage or save money. So it's really important that beneficiaries take the time to compare coverage year over year. And I wish I could tell you how many beneficiaries I talk to that have been in the same plan for 10 years. And then they finally come to us and we say, well, let's just look at your coverage and see if we can find something a little less expensive. And they're thrilled that we're here to do that, number one, and that they can actually find a plan that suits them a little better where they are now as opposed to 10 years ago. So literature comes in the mail from plans at the end of September, usually explaining any changes for the upcoming year. So don't throw that stuff away. I always tell people to get 2 boxes, one for stuff from Social Security and one in Medicare, and a box from information from your plan, because it's really important that you look that information over, because they do tell you about any cost changes, any provider network changes for the upcoming year, and you just don't want to be surprised in January. Mark? So let's talk about SHIP. What is SHIP and how do they help with OEP? So SHIP is the Senior Health Insurance Program, and it's a national program that helps Medicare beneficiaries um, make informed decision about their health care and their benefits. So we offer counseling, education, and one-on-one assistance to help people understand their health care coverage, costs, and make the best choice for their needs. So we sit with them in a personalized setting and ask them questions about their health and their finances and what it is that is important to you so that we can find the plan that meets those needs. SHIP services are available to Medicare beneficiaries under 65 with disabilities, and people dually eligible for Medicare and Medicaid, and also people with limited incomes. We are a free, unbiased resource for folks. So let me just repeat that. We are free and unbiased, meaning we don't try to steer you into any plans. We're not making any money signing you up for plans. So we are really free to make sure that the plans that we're presenting to you are plans that are beneficial to you, right? Because we're not making any money on those. So I just wanted to clarify that as well. We are not brokers. All right. So where is SHIP located? There are 54 SHIP grantees, one in every state in the country, plus Puerto Rico, Guam, DC, and the Virgin Islands. There are approximately 2,200 local programs and about 12,600 counselors who are mostly volunteers that conduct over 2.5 million counseling sessions per year. So that's really a lot of people that we touch every year with SHIP. Not just doing open enrollment. We are available year round, because things come up with Medicare year round, right? Claims, billing, appeals. We can help with all of that throughout the year. But at this time of year, we're mostly focused on comparing plans and making sure people are, good for the upcoming year. Local SHIPs do extensive outreach in their local communities. They educate people on Medicare and Medicare related issues. They have vendor events. They do a lot of speaking engagements. So they really are connected to their communities. In Colorado, there are 16 SHIP affiliates with over 220 counselors ready to help in the following counties. Go ahead, Mark. Where is SHIP in Colorado and how can I reach them? So I won't read all of these counties to you, but I put them in alphabetical order so you can have a better time finding out if your county is represented here. But if your county is not, then I would call the closest county to you. And you could either make an appointment and come into the office and speak with someone, or you could do it over the phone. I find, especially since COVID and we haven't really been in the office, I can do 99% of this work over the phone, especially if people are pretty computer savvy and they can send documents by online and that kind of thing. But if not, we can always do in-person appointments as well. Some people are more comfortable with that, and that's completely fine. So I just wanted to show you the counties that we're in so that, you can look and see if your county is there and, or a county closest to you. Oh, fun fact. Not all SHIP programs around the country are called SHIP. Other states use different names like Sheba, you'll hear it, Shine, or SHIC. So you'll hear it in different forms, but we're all SHIP and we're all here to serve Medicare beneficiaries. Mark? So where is SHIP in Colorado and how can I reach them? To find your local SHIP office, call 888-696-7213 and enter your county of residence to be directed to your nearest SHIP location. So they really make it easy for you to find your local SHIP office. Again, the number is 888-696-7213. Enter your county and you'll be automatically directed to your local SHIP. So I've heard about some big changes to Medicare this year. So what are they? Due to the IRA, the Inflation Reduction Act, which was signed in 2022, many of you are aware that insulin was capped at $35 and out-of-pocket costs for adult vaccines were eliminated in 2024. The IRA also allows for more beneficial changes for Medicare beneficiaries in 2025. The first one is on December 31st, the so-called donut hole or coverage gap is eliminated. And that means beneficiaries will no longer face a change in their prescription drug cost sharing when they move from the initial coverage phase to the coverage gap phase. So let's applaud that's a fantastic development. Beginning in January, Medicare Part D will have a $2,000 cap on out-of-pocket costs for medication. That means once $2,000 in out-of-pocket costs for medications is reached, beneficiaries will not pay a penny more for covered drugs for the rest of the year. This is going to lead to thousands of dollars in savings for people, especially those that take high-cost drugs for cancer, rheumatoid arthritis, and other serious conditions. This is huge for Medicare beneficiaries. And then the last development that's new that I think is beneficial to Medicare beneficiaries is the new Medicare prescription payment plan. You'll hear it referred to as MPPP, and it allows for the spreading out of drug costs throughout the year instead of paying them all at once to the pharmacy. So it's referred to as smoothing. And this is a great program to help manage costs throughout the year. Again, especially if you have high cost prescriptions. It's not that great a program if you're not paying that much for your prescriptions now, but if you are, the smoothing will help you sort of manage your costs throughout the year. So some tips for open enrollment. Open and read any notices sent by Medicare or the plan. Annual notices of change and explanation of benefits are sent each September with the changes in the plan for the upcoming year. It's very important you look this over. Pay attention to any plan cost changes, benefits, or coverage, and the plan formulary. It is really important that all of your drugs are covered. Make sure your drugs are covered and that providers and pharmacies are still in your network, because that can change as well. And this should be an important consideration when choosing a plan. Are all your drugs on their formulary? And I've had beneficiaries tell me, well, I can get this drug through my doctor for free, but you can't really count on that, right? What if the doctor stops giving those drugs for free and they're not on your drugs formulary, and now you have to pay out of pocket for that particular drug? So I caution against doing that. I say make sure all your drugs are on the formulary. That's really important. And the last point is don't do it alone. Call SHIP to help you navigate your choices. That's what we're here for. We're, like we said, we're comprised of volunteers who, they love helping Medicare beneficiaries navigate this complex, program that Medicare is, right? And if you're new to Medicare, if you've been in a while, there's always things that you run up against that you need explanation about, right? Because it's so confusing. So don't go it alone. Call SHIP to help you navigate your choices. And again, my takeaway would be if you take the time to compare your plan every year, you may save yourself some money. And, who doesn't love that? Okay, thanks, Mark. I just wanted to give you some resources for the things we've talked about today. Of course, there's the SHIP number. And again, it's your local, you put in your county of residence to get your local SHIP office. Medicare is also a good resource they can help compare plans. They can help with claims, appeals, general questions. Medicare is 24/7. They're always available. But I would caution against calling them probably that last 2 weeks of open enrollment because they get slammed. So it's really important that you do this fairly early. I would say if you're going to compare plans, November is a good time to do that, to start comparing plans. You can start in October, but I tell my beneficiaries, let's just wait till the first week in November, and then we can start, looking and comparing plans then. Medicare.gov is also a great resource for all things Medicare. If you create an account on Medicare.gov, you can see all of your Medicare history, all of your current Medicare things that are going on in one place. You can see claims, billing, your drug list is there. your doctor's visits, your EOBs, all of that would be housed on Medicare.gov. And I know, much like myself, the last thing I want to do is create another account for anything. But if you're going to do it, Medicare.gov is the account to create because it lets you house all of your Medicare information in one place. You can get help through a chat on Medicare.gov. They have everything you can convert into Spanish. You can find doctors. Like you can find out if something's covered by Medicare on Medicare.gov. You can compare plans on Medicare.gov. So it is a great resource for Medicare beneficiaries. And I encourage you to at least go out there and look and play around if you haven't, but create an account. It really would be valuable. And then another resource would be the 2025 Medicare and New Handbook. These are the handbooks you get every year from CMS, the Centers for Medicare and Medicaid Services. They send out these handbooks every year. You can opt out and get it sent to you online if you'd like. But if you didn't get one at your house, you haven't got it mailed, you can go online, just Google 2025 Medicare and New Handbook, and it'll come up. That's a great resource for all things Medicare 2025. So you could also request a book from them from Medicare on Medicare.gov if you haven't got one. Oh, let me also mention on Medicare.gov, if you lose your Medicare card, you can get a replacement card there. And lots of people use it for that. But I just wanted to throw that out there in case you ever lose your Medicare. You won't get a new number. You're just going to get a replacement card. Thanks, Mark. And lastly, are there any questions for me about any of that information? I'm happy to answer any questions.
Yeah, if folks have questions, please go ahead and put them in the Q&A box. And I have a couple of quick questions for you, though, Kathy, just for the good of the whole. This, I feel like a lot of people don't know about SHIP, and it is one of these services that almost seems too good to be true. When you're dealing, especially this time of year, how long should someone expect to wait to get to speak with a SHIP counselor?
It really depends on your county and how busy they are at that moment. But I would say we strive to get back within 2 days. Now, because we're open enrollment, I would say maybe that'll go out to 3 days. But if you haven't got a call in 3 days, I would just call back and say, hey, I'm waiting on a call. And somebody will get back to you. I get a lot of the calls sent to me as well that I kind of farm out to our affiliates. So I always leave my contact number for people to call me too if they haven't got a call back. But I would say 2 to 3 days because it is open enrollment and we just get slammed right now.
And what is the process to become a SHIP volunteer?
So that's right up my alley. So we get volunteers from everywhere. We get students, we get retirees who have been on Medicare and saw the sort of trials and tribulations it was to get on and they want to help. So what we ask is that a lot of people will contact me directly and I will refer them out to their local affiliate, depending on where they live in the state. They get in touch with that affiliate and say, hey, I want to be a SHIP counselor. They have to fill out an application and that. And then they go through a training with me, a SHIP training. It's online. And depending on your computer savvy, it can take anywhere from, 4 hours to 16 hours, right? Depending on how slow you are and how, if you're going to do it all in one fell swoop or if you're going to come back and kind of piecemeal it. But it kind of runs a gamut of everything you need to know with basic Medicare. And once you have completed those trainings and then done a privacy training, which is required by the government, everybody has to do privacy training because, it's important to keep these Medicare beneficiaries' information safe. Once they do privacy, then they can become a SHIP counselor. They usually shadow someone more seasoned in the office for a while before they're let loose. But then they can start counseling as well. And we have great success. I think we probably pick up about, 20 to 30 counselors a year that come in. People drop off. We've had counselors that have been with us before I was even here. So over 12 years. And then we've had people that are just going through the training now. So it really runs the gamut. But it is a commitment. It is a commitment because the information is very complex and very dense. But once you get through it and you become ship certified, I tell you, the information you have is invaluable to you, your family, your friends, right? Once I got into Medicare, I became no fun at parties because all I wanted to talk about was Medicare. So once you get into this world, you would be the expert in your social group. So that's a good thing.
And the ship counselors, they help people year round, right? It's not just during open enrollment.
That's correct. We have most of the ship counselors are year round, but we have maybe 10 counselors of our 220 that only help Part D during open enrollment. There
Okay.
are a few that are just Part D, but most of them are full-time counselors. Yep, and it's year round, correct.
And how many people in Colorado do you help every year?
In Colorado, oh, I think I had that stat. Let's see. Colorado, I think they said we conduct. Oh, no, that would have to be, I don't have that information, Mark. I could get it, but I don't have it at my fingertips.
No problem. I was just curious. I know that you guys do great work, so I just was. I know
It's
that
a
number's
lot.
probably out there somewhere.
Yeah, I would say it's a lot, especially at this time of year. And of course, I get my regulars that call me every year and say, "Hey, it's this time of year again. You have my drug list, no changes. Can you, we get that a lot because we have our regulars. But yeah, we encourage anybody to call with any Medicare questions. If we can't answer it, we can certainly get you to somebody who can. We handle complaints. If you have a complaint about a Medicare Advantage or a Part D plan, I handle those for the state. So we are here for you.
Amazing. What a great resource. So I think we're good to go on with Rashana. Does that sound good?
Yes.
Wonderful.
Thank you, Kathy and Mark.
You're welcome.
Hello, everyone, and my name is Roshana, and I think Mark already introduced us. So let's start with S&P fraud in 2024. So as all of you know, that open enrollment is going on from October 7, as Kathy mentioned. So during open enrollment, the Medicare beneficiary will receive a bunch of scam calls. So please be aware of the calls. And let's start it with that. So how S&P support older adults to fight the Medicare fraud. Next slide, please. So 2024 scam train. What's going on right now regarding Medicare fraud? So number one is ID theft, call from the scammer, and communication method. Next slide, please. So what is identity theft? If you have Medicare or even Advantage plan or regular Medicare, especially this time of the year, you will receive bunch of call, 3 or 4 times a day, or once a day, depending on confirming that, hey, I'm calling from Medicare. I would like to confirm your Medicare number or social security number or some other personal information. Once you receive those calls, please try to recognize the unknown caller. The best thing is to do not answer the phone. Never provide your personal information such as your social security number, date of birth, or Medicare number. Never confirm on the phone. Second, hang up the phone. If you feel like, why they are trying to reach out, or I don't know this number, just hang up. You can also block the unknown caller to avoid in future to receive those kind of call. You don't have to answer the phone if you don't know, because if they want to reach out to you, they will leave the voicemail. So recognize the unknown caller and then do not provide any of your personal information to anybody on the phone. If you receive those calls, please report it to your local SNP, and I will provide you that local SNP phone number and email address. Accidentally, if you have confirmed your Medicare number, Social Security, or date of birth, please reach out to your local SNP and the Medicare as well to let them know, hey, somebody tried to reach out to me. I confirm uh, my personal information, so to put them in a loop. Next slide, please. Call from the scammer. So recently, I got like few calls already since last week that the beneficiaries are receiving call, text, or mail to sign up for Advantage plan. So that's the new thing going on. And especially this time of the year, for some reason, the Advantage plan, the broker tried to reach out to the Medicaid beneficiary via different options, like either they can text you or mail you. And then what they will tell you, if you are going to sign up with our plan or ABC plan, you will receive $100 gift card or food card every month of $50. Or if you sign up for this Advantage plan, you will get free membership of gym throughout the year. Things like that. They will offer you different options. If you receive those email or text messages, contact your plan. Never sign up with any Medicare Advantage plan without knowing your coverages and benefit. Even though the broker will tell you, okay, you will receive this or that, the coverages, benefit, you have to go through the benefit and the coverage for next year before you sign up to any Advantage plan. Remember how Kathy mentioned, you can reach out to the SHIP. You can do the plan finder with the SHIP counselor. You can compare your current plan with upcoming plan and then see the differences, and you can compare what are the benefit they are giving me next year. Without knowing that, just do not enroll in any Advantage plan. If you are not sure, you can refuse. That's totally fine. So you have to make a decision to enroll in any Advantage plan. And once you sign up, so for example, if you have AB plan this year and you are planning to sign up for CD plan for next year, if you are not aware of the coverages, and once you sign up, you'll get stuck. So please make sure, and broker cannot force you to sign up for the plan. So make sure what the plan cover and what they offer for next year. And always report to your local SNP or SHIP if the broker is trying to reach out to you, or they are, offering you different options, and if you are uncomfortable to signing up, please do not, and then report to your local SHIP or SNP. Next slide, please. Okay, so communication method. So usually what happen when they try to reach out to you, they will tell you, I'm calling from Medicare. I'm calling from Medicare. Are you interested to sign up for this plan? Or they might say, hey, I'm calling from Medicare and I would like to confirm your Medicare number or Social Security number. Your Medicare card is going to be expired, so we have to resend you the Medicare card. Can you confirm your mailing address? Or they might say, hey, we have a good offer for you for an Advantage plan for next year. Let's sign up. You know, those kind of thing, they will contact you and let you know. Now, what you have to do once you will receive those emails, text messages, please make sure that if they are legitimate or not. And you don't have to even in the email, you don't have to verify your Medicare number or Social Security number. No, because Medicare or Social Security, they will never call you directly unless you have scheduled the phone call with Social Security or Medicare. If they want to communicate with you, they will reach out to you via mail. They will send you a letter. So never confirm your personal information to anybody on the phone. And I think not this week, couple of weeks ago, I got 5 or 6 phone calls for the same issues. They received the scammer call saying that, can you confirm your Medicare number or Social Security number? And the same things, same things, same questions, and we would like to send you the Medicare card. Medicare, they will never call you directly. So just make sure you have to protect your identity, your personal information. Treat like a credit card. Uh, you don't have to carry all the time. Make sure you you, you do not want to provide it over the phone. And if you have any questions regarding Medicare, reach out to your SHIP counselor or S&P. Or if you feel like you confirm your Medicare or Social Security, or you compromise your Medicare number or ID, reach out to your local SHIP, or you can reach out to the Medicare and in order to report. That's the best way to control your medical identity or your personal information. Next slide, please. So what you can do in order to avoid scams? As I said, protecting your personal information and financial information. And especially during this time of the year, you will receive a bunch of phone call on a daily basis, I would say. Do not answer the phone. And accidentally, if you answer the phone, if you feel like it's a scammer, hang up the phone. You don't have to answer the phone. Block the caller if you are not sure, or if you are receiving bunch of phone call, just block the caller. And if somebody wants to reach out to you, or if Medicare wants to reach out to you, they will communicate you through mail. So that's the best way to avoid the phone calls. Second, it's okay if you do not want to talk with an unknown caller. Just say, I'm sorry, I'm sorry, I will reach out to Medicare directly. Just hang up. It's totally fine to be rude. You can go to medicare.gov or call 1-800 number to Medicare if you have any concern regarding Medicare, or you can reach out to the SHIP for Medicare concern like enrollment or plan finder, prescription drug, anything related to Medicare. And if you have any concern regarding Medicare fraud, abuse, and billing error, please reach out to local S&P. And I can provide at the very end the national toll-free number and also local SHIP, so an S&P. But you do not have to talk to anybody else regarding Medicare or S&P, directly reach out to medicare.gov, and our local SHIP coordinator as well as counselor and volunteers are very knowledgeable. They will call you back and answer all your questions. So then that's a good resource to find Medicare and S&P questions to get answered. Do not rush when you answer the phone, because it happens. Sometimes you just answer the phone and you just confirm your Medicare number. So please make sure with whom you are talking on the phone. They just say, I'm calling from Medicare. If by chance you confirm your Medicare number or personal information, get the phone number. If there is a phone number in the caller ID, try to keep that number, and then so that it will be easy for when you report to local SHIP or Medicare, you can let them know, hey, I received the call from this and accidentally I confirm my Medicare number. And please be aware of the Medicare scam and fraud so that you can protect your personal information, medical identity. The last and very important, please report it to S&P, local S&P, if your Medicare number got compromised or Social Security got compromised, because once you report, we will enter in the system and we will instruct you, for example, if your Medicare got compromised, make sure to keep eye on your EOB or MSN for next few months to see if there are any unexplained claims. So, for a few months, and then you have to reach out to your plan, you have to reach out to Medicare to let them know, hey, my Medicare got compromised, and you can also keep eye on your UB or MSN to see if there are any unauthorized claim and you are not sure why you receive the bill, and then you can reach out to your plan. So please, it is very important to report it to your local S&P. Next slide. Okay. So if you want to reach out to local or to the S&P, here's the national toll-free number and then phone number. And also, if you have any questions related to S&P, or if you want to report suspected fraud, or if you want to report any billing concern, please email at info.snpresource.org and they will reach out to the local SHIP or us, and we will help you to find out about the issue of bill abuse, fraud, or errors. So senior Medicaid patrols empower and assist Medicaid beneficiary, their family, and caregivers to prevent, detect, and report healthcare fraud. So now you see, you have to protect your identity. And if it got compromised, please feel free to report. And not only that, if you have any concern regarding S&P, like billing error, or if you received the bill and you did not use the services, reach out to us. Anything related to Medicare, fraud, billing, or abuse, please reach out to the S&P. Any questions?
Thank you so much, Roshana. And if anyone does have questions, please do put them in the chat box or the question and answer box. I have a couple of just quick ones for you, Roshana. One of the most common scams involving Medicare that we're hearing about on the ElderWatch helpline has to do with unsolicited phone calls that are offering Medicare beneficiaries a new laminated Medicare card. Is that something that you're hearing? And what is your
Yeah.
suggestion for people who get that call?
Yeah. So as I said, um, they reach out to beneficiaries saying that we are from Medicare and we would like to send you the new Medicare plastic card, something like that. As I said, do not answer the phone. Medicare is not going to call you directly. So if you see an unknown number, do not answer the phone. And by chance, if you answer the phone and if they say, I'm calling from Medicare, just hang up. You don't have to talk to them. Just hang up. And by mistake, accidentally, if you confirm your Medicare number, social security or date of birth, please report it to your local SNP and then reach out to your plan. The best thing is to block the unknown caller. You know how you in your telephone you can block the unknown caller if they reach out to you without the phone number. Try to do that as well. And for some reason, I got a bunch of phone call last few weeks for the same issue. Uh, Beneficiaries are reaching out to us saying that, hey, I'm getting a phone call from Medicare. Why they are confirming? So the best way to avoid, do not answer the phone or hang up the call.
Prashana, we occasionally get callers too who are reporting a situation where the person on the other line has their name and a lot of their personal information, maybe even including the last 4 digits of their social security number or their Medicare number. And this person might be claiming to be a broker. Are there legitimate brokers that call people? And in these situations, what do you suggest to folks?
Uh, I don't think the broker uh, supposed to call the beneficiary. And even so, not only in that, like last week, when the broker tried to reach out to the beneficiary, they were able to provide the beneficiary first and last name, date of birth, and even the address. So I am not sure where they get all that information, but if the broker are trying to reach out to the beneficiary, um, I would say, if just don't, they don't have to talk to them unless they want to change the plan. And the best thing is because the SHIP counselor are available throughout the year. So they can, during open enrollment, they can reach out to the SHIP if they want to if they want to change the plan, or if they want to go through the new plan. The SHIP counselor will help them to find the new plan and email it to them or mail it to them. So if the beneficiary, if the broker, so you are saying that broker are trying to reach out to them?
Correct. Yeah, we sometimes get reports from people who have received a phone call where the person seems to have a lot of information, claiming to be a broker who is going to help them change their plan.
I mean, yeah, they received the phone call, but as I said, if they, unless they schedule an appointment with the broker, they don't have to answer the phone. And the most common trend going on this year are the beneficiaries are receiving phone calls for the new Medicare card, the plastic Medicare card. And yeah, I totally understand that, they receive the call from the broker as well saying that, hey, you will receive $50 gift card or like gym membership, free gym membership for next year, things like that. Um, I would suggest go through local SHIP if they want to change the new plan.
Most
Unless,
definitely. I think that's great advice, Roshana. And
Mhm.
I mean, I think too many people get in sticky situations where they're
Right.
not sure who they're dealing with, right?
Yeah, and they're, the local SHIP are free. Uh, they are free. You can reach out to them within 2 to 3 days. They will answer your phone. They will help you to find the plan. They will help you to compare, and you don't have to enroll right away. Take your time, go through your plan details, see the coverages, reach out to the plan and ask them if you have any specific questions regarding your plan. And once you confirm, once you know everything about your plan and coverages, then you can enroll in the new plan, right? So unless and until if you are not sure the coverages benefit, please just don't enroll in any new plan, even though they will tell you, or you will receive gym membership or $50 gift card or food card, or whatever. But first of all, the most important thing, you have to know, once you enroll in any plan, what are my coverages, what are my benefit, am I getting the same coverages for this in like last year or this year, and what I'm going to miss. So the SIP counselor are the best choice because it's free, we are unbiased, and we don't get commission. So that route, I would recommend the Medicare beneficiary to go with that route, uh, and until December 7, you have the time to enroll in the plan. For prescription drug plan, you can do the same. For Advantage plan, you reach out to the SHIP. And regarding S&P billing error, billing fraud or abuse, reach out to your local S&P instead of going to the broker. That's my suggestion.
Well, one last question for you, Roshana. I'd been told before that one of the advantages of reporting directly through SMP, a fraud or like a Medicare fraud issue,
Right.
is because it kind of like expedites the process with working with Medicare. Is that true?
Mm, I let me double check, but I don't think so, because even if you have any concern, like if you want to, if you reach out to Medicare, sometime Medicare, they provide the local SHIP information, and then you have to reach out, the beneficiary has to reach out to us. I'm not sure. What do you think, Kathy?
Yeah, that's probably the best way to go. I would say that's probably the best way to handle it. Yeah.
Right.
Okay, wonderful. Sorry, I'd heard that from someone, and I was just thought wasn't exactly sure, but I think going through Medicare directly or going through your local SMP is the way to go.
Yeah, I think it depending on, so for example, if you reach out to Medicare and if it is something related to Medicare fraud, depending on the counselor or depending on who, Medicare customer service, they provide local S&P, and then we receive the phone call or the client directly reach out to us. So I mean, we are always there, so it's
Wonderful. Well, Kathy and Roshana, I want to thank you both so much for your presentations today and all the information about Medicare and Medicare Open Enrollment and avoiding Medicare fraud. And again, this presentation will be has been recorded, and we will be sharing this presentation far and wide to make sure all kind of folks going through open enrollment have all the latest information about how to access SHIP and SMP and these great, wonderful resources. So thanks again, and thank you for everyone who participated today and joined the call, and have a great Friday.
Thanks for inviting
Thank
us,
you.
Mark.
Thank you, Mark. Thank you, everyone.
Bye-bye.